1 in 4 people watching this video right now will die of cardiovascular disease. Not 1 in 100, not 1 in 50, 1 in 4. And here's what makes that number devastating. The majority of those deaths were preventable, not just treatable. Preventable, because the heart almost always sends warning signals weeks, months, even years before it gives out. Signals that most people either don't recognize or talk themselves out of taking seriously. That's what this video is about. I'm going to give you the 6 warning signs your heart may be sending you right now. And I'm going to explain exactly what to do if you recognize them. Because if you catch this early enough, you have every chance of living a long, full, healthy life. But if you wait until the symptoms are impossible to ignore, it may already be too late to prevent permanent damage. Here's what most people don't understand about heart disease. It is not a sudden event. It is a slow, silent process that builds over decades. Your arteries, the tubes that carry oxygen-rich blood to your heart, your brain, your legs, they have a smooth inner lining. Over time, a combination of high blood pressure, high cholesterol, smoking, diabetes, and chronic inflammation can damage that lining. And once it's damaged, cholesterol starts to accumulate inside the artery wall. Your immune system tries to clean it up, but eventually it gets overwhelmed, and that buildup forms what we call plaque. That plaque narrows the artery. It makes it stiffer. It restricts blood flow. And this is happening completely silently. No pain, no symptoms for years. Eventually, the artery becomes narrow enough that during moments of exertion, climbing stairs, walking quickly, even feeling stressed, your heart muscle can't get enough oxygen to keep up with demand. That's when symptoms start to appear. And sometimes, a piece of that plaque ruptures. Your body panics and forms a clot to seal it. That clot blocks the artery entirely. The heart muscle on the other side stops getting oxygen and begins to die within minutes. That is a heart attack. The warning signs I'm about to share with you are your body's way of telling you that process is already underway. Before the rupture, before the clot, before the damage becomes permanent. Please listen. The first sign is chest discomfort. And I want to be very specific here because this is not the dramatic, crushing, clutch your chest moment you've seen in movies. Early heart disease rarely announces itself that way. What people actually describe is more like a vague pressure in the center of the chest. A fullness that's hard to put into words. Sometimes a burning sensation they mistake for indigestion. A tightness that spreads across the chest like a band being pulled tight. The key detail is when it happens. This type of chest discomfort is triggered by exertion or stress and relieved by rest. You walk up a flight of stairs and feel that pressure. You sit down, it fades. You carry the groceries in from the car. It comes back. You rest and it goes. If that pattern sounds familiar, do not wait. Do not tell yourself it's indigestion. Do not wait for it to get worse. That predictable, exertion-triggered pattern means your coronary arteries are narrowed enough that your heart is struggling to get the oxygen it needs. You still have time to act on this, but only if you act now. The second sign is shortness of breath that doesn't make sense for what you're doing. Everyone gets breathless during intense exercise. That's normal. What's not normal is becoming breathless, doing things that used to be easy. Walking up one flight of stairs, carrying a bag of shopping, making the bed in the morning. If you're stopping to catch your breath, doing things you managed just fine 6 months ago, that is a significant change. And it's one of the clearest signals that something is wrong with how your heart is pumping. When the heart muscle is weakened, it can't push blood forward efficiently. Blood backs up into the lungs. Fluid leaks into the air sacs. And breathing becomes harder. Many people with early heart failure notice they need to sleep propped up on 2 or 3 pillows, or they wake in the night gasping for air and assume it was just a bad dream. Don't attribute a declining exercise tolerance to simply getting older or being out of shape. A progressive decline in what your body can do is a red flag that deserves investigation. The third sign is unusual fatigue, and this one is particularly important for women. I'm not talking about normal tiredness at the end of a long day. I'm talking about an exhaustion that doesn't improve with sleep. A heaviness that makes even simple tasks feel like enormous effort. You might feel like you have the flu, that all-over weak, foggy feeling, but without the fever or the cough. Making the bed feels like running a marathon. Taking a shower leaves you needing to sit down. This happens because when the heart isn't pumping efficiently, your muscles, your brain, your organs are all running on reduced oxygen supply. Everything becomes harder because everything is underpowered. Now here's the critical piece. Research shows that up to 70% of women who have heart attacks reported unusual fatigue in the weeks leading up to the event. Not chest pain, fatigue. And that symptom was frequently dismissed by doctors, by family members, and by the women themselves as stress or anxiety or just being run down. If you are a woman experiencing persistent, unexplained fatigue that is interfering with your normal life, please get your heart checked. Don't accept you're just stressed as the final answer. The fourth sign is swelling in your legs, ankles, or feet. At the end of the day, your shoes feel 2 sizes too small. You pull off your socks, and the elastic has left deep indentations in your skin that take a long time to fade. Your ankles look puffy in a way they never used to. This is caused by a heart that isn't pumping blood forward effectively. When the heart struggles, pressure builds up in the veins, returning blood back to the heart. That pressure forces fluid out into the surrounding tissue, and gravity pulls it down to your lower legs and feet. A little ankle swelling after a long day on your feet can be normal. What's concerning is swelling that doesn't improve overnight. Swelling that keeps getting worse week by week. Swelling accompanied by breathlessness or fatigue. And unexplained weight gain, sometimes several pounds in just a few days, because your body is retaining liters of excess fluid. That combination needs urgent evaluation. The fifth sign is palpitations or an irregular heartbeat. Your heart beats about 100,000 times a day in a steady, controlled rhythm. When that rhythm goes wrong, you feel it, a racing sensation. A fluttering, like something trapped in your chest. A skipping, where it feels like your heart missed a beat. A pounding that makes you suddenly, uncomfortably aware of your own heartbeat. The most common cause that concerns doctors is atrial fibrillation, where the upper chambers of the heart quiver chaotically instead of contracting in a coordinated rhythm. Atrial fibrillation dramatically increases your risk of stroke. When the heart beats irregularly, blood pools inside the chambers and forms clots. Those clots can travel to the brain. That is a stroke. Many people with atrial fibrillation have no symptoms at all and only find out after a stroke has already happened. But some do feel palpitations, dizziness, or episodes of breathlessness. Occasional palpitations from caffeine or poor sleep are usually nothing. But frequent palpitations, ones that last more than a few seconds, ones accompanied by chest discomfort or dizziness. Where you all wansidar akir adiurus sur those need an ECG. Because if atrial fibrillation is found, blood thinners can prevent a stroke from ever happening. The sixth sign is pain in your jaw, neck, shoulder, arm, or back, and any such process. And this is the warning sign that gets people killed because they don't connect it to their heart. The nerves that carry pain, signals from your heart, share pathways with nerves that supply your jaw, your neck, your shoulders, your arms, and your upper back. So when your heart is struggling, the pain signal can arrive anywhere along that pathway. A woman feels an aching between her shoulder blades when she walks upstairs. A man feels his jaw throbbing during physical exertion. Someone feels a deep discomfort in their left arm they've been putting down to sleeping awkwardly. The question to ask yourself is this pain triggered by exertion and relieved by rest? Because if it is, that is your heart talking, not your muscles, not a pulled ligament. Your heart. Women are especially likely to experience heart attacks this way, with with no chest pain at all. And because the symptoms are atypical, they're more likely to be dismissed, more likely to be delayed in treatment, and more likely to suffer damage that could have been prevented. So what do you do? If right now you are experiencing chest discomfort with shortness of breath, sweating, nausea, or pain radiating into your arm or jaw, stop watching this video and call emergency services. Right now, don't drive yourself. Don't wait to see if it passes. Heart muscle dies within minutes without oxygen. Doctors call the first hour the golden hour. Treatment in that window saves lives and saves heart muscle. If your symptoms are less acute but have been building, progressive breathlessness, persistent fatigue, ankle swelling, frequent palpitations, or make an urgent appointment with your doctor this week. Not next month. This week. Describe your symptoms clearly, when they started, what triggers them, whether they're getting worse. Your doctor will likely start with an ECG to check your heart's electrical rhythm, blood test to detect cardiac enzymes, an echocardiogram to see how well your heart is pumping, and possibly a stress test. Treatment options are highly effective when caught early. Merchordas tinsi sa medications, procedures to open blocked arteries, cardiac rehabilitation programs that can restore your fitness and quality of life. And beyond medical treatment, if you smoke, stopping is the single most powerful thing you can do. Within 1 year of quitting, your heart attack risk drops by 50%. Control your blood pressure and cholesterol. Move your body regularly. Eat a Mediterranean diet, whole foods, fish, vegetables, olive oil, nuts. Manage your stress. Sleep 7 to 9 hours a night. These aren't just lifestyle suggestions. They are medicine. I've spent years watching people arrive too late. People who had the warning signs for months and dismissed them, who felt the fatigue and assumed it was work, who felt the chest tightness and blamed indigestion, who noticed their ankles swelling and figured it was the heat. And I've watched others who caught it early, who came in before the heart attack happened, who got treatment, made the changes, and are still out there living their lives, walking cunning grime. Walking their dogs, watching their grandchildren grow up. The difference between those two groups is almost always the same thing, whether they took the warning signs seriously or whether they waited. Your heart is talking to you. Make sure you're listening. If this video helped you, please share it with someone you care about. It might be the most important thing they watch this year. Subscribe for more, because there's a lot more your body is trying to tell you, and I'm here to help you understand it. Take care of your heart. It's the only one you've got.